Priscilla is a community health nurse at a health facility in the village of Kasem in Ghana. She's conducting a follow-up home visit in her community today.
With my wheelchair situation, she's a woman who is more concerned of the health of her children. We've been having this child welfare clinic, and she complained of the stigma when she comes. We told her that even if she doesn't come, we will come to her house, and if the child is due for any vaccination, then we give to her.
In 1999, Ghana introduced the Community-Based Health Planning and Services, or CHIPS, to bring health care to the doorstep of the people. In 2020, Ghana had 5,700 CHIPS compounds, with an average of one community health nurse for every 750 households.
Me din de Helena Texan Gariba. Me take health post here. Me wo accommodation wo CHIPS compound here. Dey me ni GSM aba ha se me ye adwuma de asom me man. Nipa dodo e wo community ha se be nipa 4,000. Community no me farmers e no mo san nyune kente. Nti omo sikasem no e ya na e wo fam.
Being the first port of call for health care, Helena and Priscilla know their community very well. But their client on today's home visit comes with multiple vulnerabilities.
Me madodo ye enkono na ba kokura henia won so a wo se me ye no insurance na me koyi. Me nyamwa me pe e bi se adwuma me se me ye ne ha impokura no de bia ma ke me for seed hotel ho no enye fa ya didiem bi wa me ko we ho am se bia free me bia mo e bia free me bia bayere ti nu se scan me kan sam pokura no so me nso no na asa me ma no na me ni omu nyina na wa ha na ma ho kire nti no miensa ati wo mo ho a omo ne obi na ti a omo nka me ho bi.
We realize that for the vulnerable people, for the poor, they come with many conditions that is multi-sectoral. But a lot of that converges at the level of the health worker, the community health nurse, who sees the malnourished children, the abused child, the child who is not vaccinated, the child who doesn't have an NHIA card and so is not accessing care. And in the same community, some of these agencies with that mandate are there, but we don't seem to work together. We started working with UNICEF on the ISS, primarily because Ghana Health Service and our community system exists in all communities.
Started in 2020, the Integrated Social Services Initiative, or ISS, aims to strengthen linkages between health, social protection and child protection service providers on the ground. The Ghana Health Service already has linkages with programs such as the Livelihoods Empowerment Against Poverty, or LEAP program, which provides cash transfers to the extreme poor. All LEAP beneficiaries are entitled to free health insurance, quarterly health visits, and referrals to other social services. But there are challenges in practice.
Our CHOs plan and conduct home visits regularly. But prior to ISS, we had no idea who the LEAP beneficiaries were. And so they were conducting the home visits all right and leaving out the LEAP beneficiaries. There was no way we could pick out somebody who was a LEAP beneficiary and for that matter do any specific targeted documentation on a LEAP beneficiary.
Under the ISS, health facilities at the district, sub-district and community level will receive technical and financial support to extend routine health services to LEAP households in a targeted manner. During home visits, CHOs normally provide services such as growth monitoring, vaccinations, and antenatal care. But under the ISS, they will now record the NHIS status and card numbers of LEAP members as well, due to the entitlement of free NHIS. If a LEAP member does not have NHIS or has expired NHIS, they record this to share with social welfare and NHIS for further action.
Our data shows that a lot of the LEAP beneficiaries are not seeking care, and it's because of financial related issues. The ISS really has provided a strengthened linkage between LEAP beneficiaries in line with our agenda to leave no one behind in the universal health coverage.
Beyond LEAP, This ISS strengthens referral pathways with social welfare officers for all matters pertaining to child protection and family welfare.
Our staff have benefited immensely from trainings in ISSOPs organized by the Department of Social Welfare and Community Development. We were taken through reporting forms, how to identify vulnerable cases in the community, and even how to document what we see in terms of social issues. You know, we are not social workers, so that aspect of the training really benefited us. We're also able to do a feedback to the sub-districts down to the community health officer level for them to be able to pick up the cases and do the documentation properly and refer cases to the appropriate quarters.
To make these linkages possible, Ghana Health Service is linking information management systems with other sectors.
The existing system is that the various key agencies involved in ISS are running vertical and independent information systems. But in order to facilitate the generation of common indicators of interest and also use that information to plan and deliver comprehensive care and complement each other, it has become necessary to find ways of making the different information systems speak to each other.
For LEAP, this involves adapting the new e-tracker to record and share data on LEAP households stored on the LEAP MIS.
The e-tracker is a system that ensures that we have transactional data, data that shows the continuity or the continuum of care and allows one to track an individual or a person, the services they are getting. This is really beneficial because it reduces the burden of one service provider having to carry so many forms and registers. The ISS system means address across the country no longer have to knock on many doors. Our community health workers and officers across the country can refer case as the one that Adwa was dealing with for support to a social welfare and a health insurance officer anywhere, because the ISS has already created the communication channel and the service delivery channel and the opportunity for referral. This really goes beyond what a traditional health system provides, and that is our vision for this.